Hi everybody, this is Carol from STS. This is the Adult Cardiac Surgery Database monthly webinar for February. We're going to get started here. First, I just wanted to wish everybody a happy post-day Groundhog's Day. I hope that you had a good weekend, and just wanted to share a funny picture with you. If you all don't know, there's a Puxatawny Phil. He has been right about 50% of the time in the last 10 years. However, I've recently learned that there is a groundhog in Maryland. I'm not sure of her name, but she has been right 60% of the time. Imagine that. But so there's Phil's predictions over the last 10 years. And he's always been saying that we're going to have more winter. So which means this time he did see his shadow, which means 6 more weeks of winter, and can't leave a webinar without a Bernie meme. So just wanted to share that with you. All right, so on the line with me today from STS, I have Jane Hahn, Leanne Jones, Addie Dolan, and Sydney Clinton, and Melinda Offer, who's managing our FAQ mailbox. And then from IQVIA, we have Jeanette, Jean, Joe, and I think that's all. So Melanie's not with us today, but we will get through with the rest of our crew, our wonderful crew from IQVIA. So thanks everybody for joining. We're going to have some important dates and updates, IQVIA update, and then Q&A, of course. Please use the the Q&A box. I see a message here that says it's not letting me call in. For some reason, the 800 numbers are kind of touchy. So if you could use, there's a direct local number. Try that number to call in if you're having issues. And maybe, Leanne, if you could put that in the chat box for folks to see as well. All right, some important dates from Adult Cardiac. We have the monthly webinar today. Harvest 1 closes on February 12th at 11:59 p.m. We will not be able to extend the harvest due to MIPS reporting. We have been talking about it since December if there was any possible way, and there's just not a way to extend it. So try your best to get your data in by February 12th at 11:59 p.m. Eastern. The adult user group call is on the 17th at 2 p.m. and then opt out for Harvest 1 is February 17th by 11:59 p.m. When you opt out of data, if you already have data in the warehouse that you've submitted since the last harvest close, which was in December, the last harvest close contained data through September 30th. So if you've submitted any cases from October 1st through now, at the end of the Harvest 1 period, which is December 31st, 2020. If you submitted any cases and you decide that you're going to opt out, what that means is that those cases do not go into analysis and you will not receive a star rating. Just so you're aware of what opt-out means. It doesn't impact your site's relationship with STS any. It's just that you wouldn't be included in analysis if you're not feeling that your data is clean or you aren't able to get all your cases in. If you are able to get half of your cases in, I would still, and not 100% completeness, I would suggest opting out just because you do not want to be, you don't want to be analyzed on incomplete data. We have the next monthly webinar is March 3rd at 2 p.m., St. Patrick's Day, March 17th. We have a user group call at 2 p.m., and then we're expecting the public reporting refresh for adult cardiac using Harvest 1 2020 data in the spring. So I wanted to go over some updates specifically for the harvest close that's coming up on the 12th. And then I also the risk score match report and benchmark report, I wanted to just provide some clarification and updates on those as well. Also, the data manager survey that we took last fall is available on the STS website, and I'll take you there. I'll show you where that's at after the presentations today, just if you needed to download it for your site or if you want to share that with any of your coworkers, you certainly can do that. All right, so we'll start with the harvest cleanup. This is considered Harvest 1 2020. It closes on February 12th at 11:59, and it will contain OR dates through December 30th, 2020. So it's important to remember that the Harvest numbers are always the preceding quarter. So Harvest 1 contains data through quarter 4 of the previous year. It will contain 12 months. What will be analyzed during this harvest is 12 months of cabbage data and 36 months of valve and valve or valve plus cabbage data. It does not mean that you need to go back and resubmit 12 months of cabbage data and 12 months of valve or valve plus cabbage data. What this means is that whatever's in the warehouse will be combined with your new submission and sent over to DCRI for analysis. So if you've made a submission for Harvest 4 2020, which contains data through the third quarter or through 9/30/2020, um, you've made that harvest and no changes were made to cases prior to October 1st, then you can just submit your new cases from October 1st, 2020 through December 31st, and there's no need to resubmit older cases. If you did make changes to cases prior to October 1st, 2020, then you will need to, after Harvest 4 closed, if you made changes to cases prior to October 1st, 2020, then you need to submit your new cases from October 1st through December 31st, 2020, and then you'll need to submit any cases that you made updates to prior to 10/1/2020. And this could be a small file or it could be multiple small files depending on how many updates you were. You just need to make sure that the file or files that you submit for those updated cases contain a date range that contain the updated case. So for example, if you you submitted your data for Harvest 4 2020, which contains OR dates through September 30th, if you submitted that data for the Harvest 4 and all went through, but recently, say in December, you realized, oh my gosh, I forgot to code that this patient was a smoker, and it's a case from March. You can go back to that March case in your vendor software, make the adjustment, but you'll need to upload a small file that contains that March case. So say it was a March 15th case. I would suggest uploading a file that maybe contains a week's worth of data. So maybe from March 10th through March 17th, just so that 10/15 or that March 15th case is in there. Upload a small file that contains that updated case to IQVIA in addition to your new cases from October 1st through December 31st, 2020. All right. And then the next one I wanted to talk about was an email I had sent out regarding critical errors and errors along with making sure your data was clean. And I just want to clarify a few things or provide some additional information for that to help you with this. The critical errors, they have to be resolved. It is your responsibility to make sure that these are resolved prior to harvest close. Do not just submit your data and to IQVIA and walk away from your computer. It's the data manager's responsibility to make sure that they clean up and resubmit errors and critical errors prior to harvest close. If you don't do this, the integrity of the data and the database is at risk because of your negligence. So it's really important, and I know I'm using a big word there, but it's a strong word, but it's really important to make sure that you clean up your critical errors and your errors. Now, critical errors, the record won't get into the data warehouse. So if there's a critical error and you don't address it, that data will not be included in your data that goes to analysis. If there's an error, it is that record or that file, I'm sorry, that record will still be included, but it's something very significant that really needs your attention and is logically inaccurate. So these errors, some of them will be updated in an upcoming release from IQVIA, and they'll be changing over to critical errors after the harvest closes, so it won't impact this harvest. You won't need to worry about getting these records rejected, but it is important right now for this harvest that you go back and you clean up any errors that you have. The only exception to that is the TIN error, which we highly encourage that you provide for your surgeons. The TIN error is used in MIPS reporting, and that's how your surgeons, that's how we connect your surgeons to the MIPS reporting and how they would get reimbursed for MIPS reporting. Right now, MIPS reporting is the only thing that STS has that is dependent on the TIN being available, but it's likely in the future that there will be other reimbursement programs that require TIN to be available. So although it's not going to reject your record at this time, we still want you to provide that information. However, I'm not saying to go back and review 36 months of data and put your tin in for 36 months of data in the next week and a half. I don't want to waste your valuable time doing that, but I suggest that after this harvest closes, if you're not providing the tin for your surgeons, that you go back as far as you can, at least to January of this year, but even back to January of the previous year if you have time, and enter that tin in. So um, if we ever do get uh, directions from CMS that they'll be using our database for reimbursement, it's available and you won't have to go back and redo that work. The next thing is the missing variable report and warnings. Missing variable report and the warnings aren't as critical errors or errors. It's the missing variable report is and the warnings are something that you should review. They may need your attention, but not all of them are going to need your attention. They're just mainly a heads up, like, hey, take a look at me, make sure I make sense. And if it does make sense, then you can just move along and not worry about it. But some of them might actually be helpful for you to ensure that you have your data entered in correctly. The mortality fields, oopsie, sorry. The mortality fields, these are the 3 fields you'll want to review in the MVR related to that 2% missingness. So it's the discharge mort stat, the MT30 stat, and the MTOPD. These fields, if you have a greater than 2% missingness, you will not receive a star rating. If you're even close to a 2% missingness, if you're at a 1.75, you are still at risk, because once that data goes over, these are estimates that IQVIA is providing. They're not analyzing the data. So once the data goes over to DCRI, and this is no different than the DQR report that DCRI provided for prior harvests in 2019 and before. They always had a little warning in there that said if you're close to the 2% missingness, you're at risk for not receiving a star rating, because once that data goes into analysis, the slightest change could move a case out of analysis, causing you to have a lower denominator and making that 2% a higher reality for you. So although IQVIA and DCRI are nearly 100% aligned on the PRAC IDs and things like that, even at there's still a slight chance that if you're even close to this 2%, that you are at risk of not receiving a star rating. So please do your best to get this number much lower if you can. The other thing that I saw during the harvest, after the harvest closed and the reports were updated on the IQVIA platform, is that sites were contacting me and saying, but I have this field, and it was specifically on the mortality fields, is they were showing me that they had this entered in IQVIA, but DCRI is saying that they didn't have it, so they assumed that IQVIA was making a mistake. IQVIA keeps a log of all the updates that are made to as far down as to each field, so they can see when you upload a record for a record that's already in the data warehouse, you upload an updated record with one field change, they can tell you what that field was at what a point in time and when it got changed to a different value. So what sites were saying is that, hey, I have submitted this and I can see in my vendor software that it's correct. I can see on the IQVIA platform that it looks correct, but now DCRI is saying that it's not correct. And when we went back, what was discovered is that the updates occurred after harvest close. And sites were thinking that they updated the data, and even though it was after harvest close, that it should still have been applied to the harvest that DCRI had analyzed and provided those star ratings back on. But that's not what happens. So once the harvest closes, IQVIA takes a snapshot of your data, whatever's in the warehouse at that time. If you're missing mortality on 5 patients and you think, oh, the harvest closed, it's not a big deal because we have open submission, I can go back and update those anytime. That's not the case. Whatever's in the warehouse at the time of harvest close is what's going to go over to DCRI for analysis. So even if you go in the day after and you update mortality fields, it's not going to be applied to the harvest that the snapshot was, the data that the snapshot was taken on. So it's really important to make sure you get the correct data in prior to harvest close and make sure that this missingness for the mortality fields is way less than the 2%. There was also an issue with the star ratings. Right now, we look at each individual year that goes into the star rating calculation for missingness. So for this previous year, we looked at 2020, 2019, and 2018. And I think it was so it was half of Harvest 3 for 2020 was half of 2020, all of 2019, all of 2018, and half of 2017. We look at each individual year to make sure that you're within the 2% missingness. And this is historically, so what that means is that we look at all the data that was in 2020, which was only 6 months of data for 2020, but it looks, but so you have a much lower denominator. So if you're missing only one case, that really could cause you to go over the 2% threshold. This is historically held over from when we weaned in the thresholds for mortality back in I think it was 2015 we had 10%, 2016 was 5, and 2017 was 2%. So historically this has made sense, but now it's kind of not, it's kind of something that are not quite sure that it's the best way that we should be looking at the missingness across the whole board. So our task force and our workforce chairs are reviewing this threshold related to the whole cohort of data, not just based on years, but based on the whole time frame. So more information will be coming on that if there's any changes with that. But for right now, it's important to make sure that each year that's submitted is under this 2% missingness. All right. The risk score match report is another report that's available in the IQVIA platform. It shows the agreement rate between your vendor software and your vendor software calculated risk score and what IQVIA is calculating. Some sites like this, they do internal quality checks or they have homegrown databases that they compare. They want to make sure that they're calculating the risk score correctly. So they use this tool to check that. It's normal to have a very small discrepancy, usually less than 1% between on the risk score match report. However, sometimes there might be a larger discrepancy shown, which could be usually it's something that occurred on the vendor side. Not saying that the vendors are doing anything wrong at all, but sometimes that happens for various reasons on the vendor side if they push a new update through on their software. So if you see a large discrepancy in this risk score match report, reach out to IQVIA, the IQVIA support, because they'll need to work with your vendor to do a root cause and help your vendor work through the problem. If there is a large discrepancy on your risk score match report, no need to worry because it will not impact your harvest submission. It just means that there's something going on with the calculation that's occurring on your vendor software. So reach out to IQVIA, they'll work with your vendor, but no need to be over alarmed about it because it will not impact your harvest submission. And then finally, the STAR and benchmark reports are available. We have H1 2020, the benchmark report, the STAR and benchmark report is available for that, and we just posted the benchmark report. And then Harvest 2, 3, 2020, both reports are available. The STAR reports look pretty good, actually look really good. There's no issues there. The benchmark reports are fairly complicated reports with a lot of logic built in the backgrounds. They look pretty good, but there are a couple issues. Also, there's a lot of variables that we're reporting. So it looks pretty good, but there are a couple issues I just want to make you aware of so you don't think something is wrong on your side. The renal failure, so this is in the complication summary. So you'll see when you open up the benchmark report, it'll look very similar. The tabs will look very similar to the sections within the data collection form. So you'll have admission, risk factors, operative, post-op, and then post-op complications, discharge, readmission, things like that. Under the complications tab, you'll notice there's 3 things that are missing that need to be reported out. The first is renal failure. It is missing from the complications section. But there's also another tab for the STAR reports where it is reported. So you could still get your renal failure data under the STAR reports, but it's missing from the complication section. The other one is recent recurrent AFib. We are reporting out new AFib, but the recent recurrent is missing. And then any vascular complication is missing from the vascular section under the complication section. I just want to point these out because I know sites pay attention to these, especially the renal failure ones, and we'll get down to the medication one because we use those as endpoints, either for risk modeling or for endpoints for those risk models. So IQVIA is working on the logic to update these in their report, and we hope that it'll be released fairly soon. The other one is within the discharge tab. You'll see that among eligible cases is missing. IQVIA is working on that one as well. And then they're just going to recheck the calculations for the STS light group and STS averages. IQVIA is going to be posting notification to your site, to the sites on the known benchmark issues, but I just wanted to highlight these because I know that specifically the beta blockers for both pre and post-op and the renal failure are important to sites. So they are working on those to get those out as soon as possible. Please continue to review those reports, and if there's something there that's not looking right or something that's you think is missing, please send your feedback to IQVIA support or reach out to IQVIA support, and we'll be able to check into it further. We're working together, so we'll be able to check into that further. And now I'm going to hand it over to Joe for an IQVIA update. Joe?
Great, thanks so much. Good afternoon, everyone. We do have a few items to go over today, so let's go ahead and dive in. Starting with a recap of some items that were released on January 23rd. The data quality report STS 5506, we added some additional validation checks and edits. And so those will be added for the version 4.20.2. And then an updated version of those errors, that errors and warnings list has been posted for you to the library. For the MIPS performance measures report, STS 4732, all measures have been updated to exclude patients who are identified as still in the hospital for both versions 2.9 and 4.2. And patient-centered risk adjustment measure, STS 7, exception logic has been updated to exclude emergent or emergent salvage status cases. In regard to the harvest summary report, STS 3824, an issue where the report was displaying outstanding errors for the PrEP TR variable has been resolved. And then the on the non-analyzed dashboard, STS 5386, we did receive a report of a discrepancy in the post-op event calculation, and that has been resolved. So the total number of cases that were answered, either deep sternal infection, mediastinitis, that was greater than the total number of cases that were answered either yes both or yes infectious for surgical site infection within 30 days. And so now that data element should display properly on the report for you. All right, next slide. Some items that were added the following weekend on January 28th. These are all in regard to the risk-adjusted benchmark and anesthesia report, STS 5651. We updated the calculation for blood product utilization and added the total blood products to display on the report. STS 5652, we updated the smoking counseling calculation. And so that has gone into effect as of the 28th. And then STS 5635, we updated a calculation for the STS aggregate IMA results for the year 2020. The results calculated were too low due to an exclusion update, and this has now been resolved as of that release. All right, next slide. These are updates that went into effect on February 2nd. February 2nd. STS 5653, we updated the report logic for the MIPS report regarding the tobacco use criteria 1 and criteria 3, and this will now correctly consider the never smoker harvest code in the performance MET criteria. And then 5695, the MT30 stat variable is on the missing variable report. That is now going to be flagged as missing if the option unknown is selected on the patient record. All right, next slide. The following are going to be some items that are targeted for later this month for February 2021. Starting with STS 5522. The validation severity will be updated for identified data quality checks from an error to critical error, and a list of impacted variables will be posted to the library. Please note, and this is highlighted for you in 2 asterisks, this will not occur prior to the coming harvest. So this update will wait for you to get this harvest taken care of, and then this update will go into effect after that. So you don't have to worry about that interrupting your workflow. STS 5700 for the benchmark report. We are aware of an issue. Sorry, let me start over. We do have some updates on the way, rather, for various calculations in the benchmark denominators. And once that update has been fully reviewed and applied, we will post a full listing of impacted variables to the library for your reference. SCS 5708. The any infections category on the benchmark report under complications is currently not displaying any data. So we are looking to update that so the data displays correctly for you. And then STS 5721. We are seeing that the results for the STS aggregate data for preoperative beta blockers appears to be lower than was previously reported. So we're double checking into the logic to identify possible causes, and we'll update the report accordingly once we have that resolved. And then the last one on this slide, STS 5696. For the MIPS report, the MIPS report will be updated to exclude transcatheter and canceled cases from the report denominator criteria. I think we have one more slide, maybe
Yep.
2 more.
Yeah, thanks, Joe. I will go to the next slide. I just want to highlight this STS 5522, the validation severity. This is moving some of these errors into the critical error severity level. So it will not be applied until after the harvest closes. That's why it's really crucial that sites go in and review those errors, things that are coming up as error, and update and fix them. You should not have any errors unless it's a TIN error on your final data quality report for your submission for this harvest. But just note that the next harvest, those errors are going to, what were once considered errors, are going to block that file, that record from being submitted to the warehouse. So go ahead, Jeanette.
And just to remind you all, you can also review your harvest summary report. There have been a couple of questions that have appeared in chat about, how do I see this if I haven't made changes on my most recent record submissions? So for that, please utilize the harvest summary report. And again, to Carol's point, there should not be any outstanding errors with the exception of the TIN errors that are okay if you've not had a chance to go back and address those.
Thank you. Thanks, Jeanette. Okay, going back over to Joe. Sorry, Joe.
Okay, I just have a couple more things. All right, STS 4262. This is in regard to the non-analyzed dashboard report. We are working with the STS to make updates and improvements to the calculation used for the operative mortality variable in the dashboard. So for those of you who have expressed concerns regarding that data, we are working to help make that report better aligned with what you're expecting to see there. And also STS, those are the same. Yeah, okay. Those are duplicates of each other. So if you have received a ticket or one of our agents has let you know either about 4262 or 5453, those are the same item. And that update will be coming sometime later this month. Our usual note is also there in regard to if you have submitted a ticket and we didn't discuss it on today's call, feel free to contact support to request an update if you haven't received one. But we are working on anything that's been reported to us. So even if we didn't discuss it, we are still working on it. Hopefully we can get those updates out to you as soon as possible. Then one final note here, we are aware of an issue for users who are using Internet Explorer versions greater than 11. You will encounter a display issue when you're looking at your risk-adjusted dashboard report in regard to the star rating display. You can see a little picture off there to the left side of the slide, but you'll see like a little ellipsis there after the stars. The Internet Explorer is no longer a supported browser, and so this is something that you will encounter if you're using Internet Explorer. So if you are seeing that, feel free to access the report on Edge, Firefox, Chrome, and any of those browsers should display the results for you correctly. And I think that's it.
I was trying to get my spotlight to work.
It did.
Here,
There you
this.
go.
Sorry.
You got it.
So read the highlight because that's important stuff. Okay, thank you, Joe.
No problem.
And then the IQVIA support plan, make sure that if you're submitting anything into the Q&A that you're including your participant ID, and if you have a ticket number, please also include that. Any communication to IQVIA and to STS, it's very helpful to include that 5-digit PID number. The adult cardiac participant ID or PID number will start with a 1 or a 3. And we have quite a few questions, so I'm going to go over to the Q&A. Melinda, if you wanted to try to answer some of the clinical ones, that would be helpful. I know that you're drowning in clinical questions this week in the FAQ mailbox, so if you wanted to refer people to submit them there, that's fine, just so that we don't get out of order with folks that submitted, earlier on into the FAQ. But if you wanted to answer in the mailbox or in the Q&A, that's great too.
Okay.
Thank you. I'm going to stick to the harvest questions for right now and questions related to IQVIA, just so we can help folks that are trying to clean up their data for submission, get that done. So the first question is, can we submit cases from third and fourth quarter 2019? And yep, you can submit cases from third and fourth quarter 2019. The IQVIA warehouse is set up to take cases back all the way through version 2.81, which is July 1st, 2014. So you can submit data as far back as that if you'd like. If you need any clarification, please put it in the Q&A. Next question. When the risk-adjusted results is released for this harvest submission ending in 2020, will the composite be worth a year or 3 years for cabbage? And do we anticipate the results to be released January 2022 or spring this year? Thanks. So this Harvest 1 2021 will be a 1 year 12 months worth of data for the cabbage composite. We are going to 36 months for the cabbage composite, just not this harvest. More information will be coming and we will let sites know. But with that, it would be important, I would say, and we'll talk about this on the user group call next time. I encourage you to go back after this harvest closes and start cleaning up those 3 years worth of cabbage data, just to make sure you're ready that when we do switch to that 3-year composite for cabbage, you won't have a disappointment when that harvest closes, whenever we do apply that. But for this harvest, it will be 12 months worth of cabbage data. And we anticipate the release, we usually try to release the results for Harvest 1 2021 in in springtime. So I would look for the results around April or May, but we will keep you updated with more accurate time frame as we get closer to that time. Has there been any more discussion on adding, this one's for IQVIA, has there been any more discussion on adding a filter for procedure type to the MVR? And the second question, is there a way to export anesthesia report for all categories and all procedures, or do we need to export every individual category for each procedure type?
This is Jeanette. So this is an area that we are still looking into regarding the MVR, any adjustments to the MVR filters. And at this time, the anesthesia section of, I believe that may be the participant dashboard report, the non-analyzed dashboard, based on the procedure selection when you first come in. If you wanted a procedure specific view, you would need to export each section in turn, but if you want an aggregated view, you can choose multiple procedures and then load the anesthesia section with all of them combined. So that is your choice right now, and that's what's available at the moment.
Great, thank you. Thanks, Jeanette. Next question is, TVT just came out with version 3 for TAVR and transcatheter mitral therapies. Did STS come out with any changes in their registries as far as mitrals? She's asking because the echo readings are a little bit more detailed. They're asking for more detailed information in the TVT registry for mitral. So to answer your question is no, we're not, STS is not going to get as granular as the TVT registry does for TMVRs. We collect what we need for purposes of the STS. The TVT registry is really specific for those mitral valve procedures, and the values that they're collecting, if they're listed there, have recently been reviewed for the TVT registry, and it's in they're very specific to mitral clip procedures. So STS will not be adopting those as well. Do you have to complete so many harvest reports in order to get a star rating score? Hi, Mackenzie. I'm not sure I understand the question, but if you'd like, you just have to make sure that you meet the thresholds for the missingness in the mortality fields and that you meet the case count that's required. In the IQVIA platform underneath, I think it's resources or library. I always call it the resource library because I'm never clear. I forget what we call the tab. But
it's resource library. You've got it, Carol. There's
okay,
a header
good.
called resource, but then underneath that, the link says library. So the actual link in the left nav says library.
Okay, so if you click on that, Mackenzie, under there, you'll see the report overview for adult cardiac. That report will tell you everything that's needed to get your star rating. So review that report, and if you have any questions, feel free to reach out. I'd be happy to help you. For IQVIA, under missing variables now has all addresses and date of birth as missing. Has it always been that way? And I am just now noticing.
This is Jeanette from IQVIA. We've not made any changes to that recently. So I think that may be an area that perhaps you just haven't really seen previously.
Thank you. Okay, I'm gonna let Melinda take the clinical ones, and if we have time, we'll come back to them. And I'm going to stick to the other ones.
Oh,
This
okay.
one's-
So
Yeah.
so a patient came through the ED.
Oh no, I'm gonna let you take those, like type out the answer or refer them to the
I
mailbox.
gotcha. Okay.
Thank you. Yeah, just so we can get through the harvest closed ones, and then we can get back to the other clinical ones, because I feel that folks are submitting into the FAQ and they're waiting for a response, and then some folks are coming in here, and I just want to make sure we're fair to everybody. What are the expectations for the following patients who have been discharged to an acute care facility? Do we have to continue to follow this patient for non-cardiac related exploration? How do we document that? So yeah, you need to continue. Melinda's will take that one too. Next one, do dashes in the benchmark reports represent a 0, or is the data not properly being displayed? I have a lot of dashes in my site years, some of which I do not believe should be 0%.
This is Jeanette. So it doesn't indicate that data is not being properly displayed, but it does indicate that there's not data for that particular number. So it's not the same as a 0, such as, there is data related to that and the calculated result or the count available is 0. It's that there isn't something that meets that criteria. There are some areas where that would be expected. For example, in the H1 harvest related to cabbage numbers for 2017 and 2018, those are expected, and there is a footnote that's indicating that. For other areas, there are sections in the benchmark report where it's showing breakdowns for fields by particular options. And, it's possible that given the set of records that were included in analysis at your participant, that perhaps they didn't have an option or an answer chosen for every option on every field. So that is a possibility. But if you have more specific questions, please reach out to the IQVIA support team.
Great, thank you. Thanks, Jeanette. Next question for IQVIA. It would be extremely helpful to be able to export the entire anesthesia supplement instead of exporting individual procedure types. Did you just cover this one?
I did. So that is a great feedback point. Thank you. I did describe earlier on the call what's available currently. So we will take this feedback back and look at possible adjustments for that.
Great, thank you. Is the data sent to CMS for MIPS the raw data or the analysis that is on IQVIA?
So the data that will be sent to MIPS, and your surgeons will have an opportunity to review and approve exactly what's being sent over. It will include both the raw data as well as the rate multipliers that are calculated by DCRI will be included in some of the measure formulas. And there will be an interface that you'll be able to see exactly what would be sent to CMS within the system. I will point out that those numbers, those calculations will run on the raw data. So while we do have the harvest close coming up, and that is what will be used to generate the rate multiplier information, if there is something that needs to be corrected or adjusted, submissions that occur after February 12th are eligible for inclusion in the MIPS submission, as long as they are done before your CMS approval is completed. And there will be more information coming out about that process for MIPS participants in the coming weeks.
Thank you, Jeanette. That was very helpful. Next question is, we were unable to contact some patients for 30-day follow-up. What percentage of completeness for 30 days mortality is required to receive an executive report? So Cassandra, you have to meet the 2% threshold. If you have greater than 2% missing, you're at risk of not receiving a star rating. Next question, if we do direct data entry now and make changes to cases prior to 10/1, do we need to do anything? That's a good question.
This is Jeanette. So I would remind those of you that are using direct data entry, please make sure that if you do make any changes to surgical records that are within the time period for harvest, that you do mark those records as complete. Only complete records that have IQVIA listed as the vendor would be included in the harvest data cut. If you are a new adopter of direct data entry and previously utilized a vendor for submissions, then any updates you make to those vendor submitted records where the vendor is something other than IQVIA, those changes, please save them, and those will be included in the harvest automatically. You are encouraged, strongly encouraged, as Carol's been sharing out, to refer to the missing variable report and the various reports and interfaces for cleaning up and reviewing your data. That is the same whether you're doing vendor submission or direct data entry. Carol, is there anything you want to add?
No, I think you covered it. It's I would just say that just to summarize, that if you're a new user if you're using the direct data entry, you're entering a new case, make sure you hit save on it. If you go back and make a change that was also entered using direct data entry, make sure you hit save on that change. And then if you used a vendor previously and you're now using direct data entry, that if you go back and update a case that was previously submitted via vendor software, you go back and make an update in direct data entry on that patient, you have to hit complete, save complete, correct?
If the vendor on the form is listed as IQVIA, then the form would need to be marked as complete, yes. But if the vendor is another vendor, then all records will be included in the harvest analysis, not just the complete ones.
Got it. Thank you. Okay. If we have a patient whose 30-day mortality won't be complete until after harvest, how does this affect the data and missing report? So well, you should have the harvest. It contains data through December 31st, 2020. So you should have those 30-day mortalities as of 4 days ago. And so I'm not sure, Tabitha, if I'm answering your question or not, but you should have it there for your 30-day mortality. Let me know, put something in the chat or the questions if I didn't answer your question. And we have quite a few questions. I'm not sure we'll get through the rest of these in 14 minutes, but we'll do our best. I still struggle with the DQR reports when cleanup has been performed in the same time frame is resubmitted. We don't get this information back if there are still missing items or warning. Only any new file that may be submitted in this time period. Am I missing something? It sounds like she's not getting anything wrong back because she's corrected it, unless I'm off.
Yeah, so when you resubmit a file, the system will process the records that have been updated, so you can quickly see what records the system has detected as changed from a prior submission and get the status on those. If you'd like to see the current state of your overall record set that are eligible for inclusion in the harvest, then please utilize the harvest summary report. That will show the errors and warning validations that are present on all of those records, and you can put in your surgical date range that you'd like to see, allowing you to focus on, maybe a particular quarter or all 3 years, whatever your preference is. So please utilize the harvest summary report if you'd like to look at all those records for the harvest overall.
And I just want to clarify on that. I think what some sites struggle with is that they know that there's a record in that file. So they're cleaning up their data. They're going to make a resubmission on a file that was already submitted. They're updating a couple records within that file, but they're expecting to see the warnings still show up for the other records that they didn't touch. And that's not going to happen. You're only going to see the records that were updated in the warehouse. So I don't think you're missing. I think it's, let me know if that makes sense, Jennifer. Next question. I am getting a critical error for quarter 1 and 2 for missing MPI numbers. I made some changes, so resubmitted. The MPI is in Apollo. I submitted the error to IQVIA and was told it would not affect my harvest, but it is a critical error. IQVIA?
This is Jeanette. So what that means is that the changes that you made in Apollo have not gotten into the data warehouse if you received a critical error on that submission.
Mm-hmm.
So while it's likely that we have these records from your prior submissions present in the system, they would be included in the harvest with that earlier state. But it was identified that some participants were submitting records that were missing the surgeon NPI. And as STS and Carol can confirm, that information does need to be submitted on the record. So that validation was adjusted to become a critical validation so that no more records missing that NPI get into this system. So if you would like your updates in Apollo to be available in the data warehouse, please do add that surgeon NPI and resubmit again.
Makes sense. Thanks, Jeanette. The physicians are under one group 10, and our hospital has a different 10. Which 10 do we use in abstraction data collection form? I believe that should be your physician group 10. Next question, how much case volume is needed in order to receive star rating? Is it 20 or 30 cases per year? Forgot. You can find this information in the report overview that's posted in the resource library on the IQVIA platform. I do know for cabbages it is 10. For the valves, I don't want to give you the wrong number. It's either, I believe it's 36 or 30 or 36, but I would review that just to verify. It's in the report overview and under the resource tab on the library in IQVIA. Is there a plan to include 3 antibiotic elements in the adult cardiac dashboard reports? It's a great way to double check your selection since it's a star metric. So antibiotics are not a star metric. We use them for NQF, but they're not a star metric, and currently only available on risk adjusted dashboard, which is only available after your harvest closes. So I would think that it would be in your missing variable report, but we can check into that, Marie, and see where it's at. Where are the mortality fields located on the report to tell us the percent that we have? Thank you. So under the missing variable report, you're going to want to look at these 3 that are on the screen here. Discharge mort stat, MT 30 stat, and MT-OPD. Here are the sequence numbers for version, this should say version 2.9, sorry about that. For version 2.9 and version 4.20. Next question. What if the patient's phone number was disconnected already or the patient was homeless? I have a couple of those. You'll need to work with your surgeon's office to see if you can get a feedback for those patients, or if the hospital has a contact. Usually, what my experience is that if you're performing surgery on a patient that's homeless, they still have to have a place of that they're discharged to the hospital, unless they social services usually wouldn't just discharge the patient to the street, especially following a major procedure like that. So I would work internally at your facility and also with your surgeon's office and cardiologist's office to see where that patient is at and if you could get a follow-up from them. Historically, DQRs with DCRI would show us the missing percentage. We have it the mortality status. Does IQVIA have something similar? So we have the 3 fields here that are under the missing variable report. And I know that in the elaboration, we were looking at reporting this out also in a little bit different way, but I'm not sure that that's available yet. But you do have these under the missing variable report. These are what you should be looking for. Renal failure is under the post-op section and benchmark report. Last metric on the list, found it yesterday. Okay, that's great. I think for some reason there's still something else that's missing there, but thank you, Carly, for letting me know that it's there. Karen Hardison, it's also listed under ventilation section, ICU section, rather than the complication section. So maybe it's just in the wrong section. Somebody should write that down for our elaboration calls. Okay, thank you. Mortality information is only reported in the risk-adjusted data, not the benchmark detail. If we are still only going to receive risk-adjusted data 2 times per year, we need observed values in the benchmark data. So you'll receive risk-adjusted data. As always, the data is risk-adjusted 4 times a year, and it will continue to be that way. Last year was just, we just did it at Harvest 1, 2, 3, and Harvest 4, which is not yet out, but it will be. And I think I'd have to double check the reports. I'm not sure if it's the only place mortality or if we're also reporting it out in the benchmarked reports. Many missing data points in benchmark reports. Variables are there, but no data for multiple years. For instance, CVA is blank. Michelle, if you're looking under the Harvest 1 report, there are a lot of blanks there, but look under Harvest 2, 3 report and let me know if they're still showing up blank. They should not be. Leanne, could you put in the chat box or in her answer, could you give her the number to dial in because it says she has no audio? Leanne.
Yep, I'm on it. Thank you.
Okay, thank you. What is wrong with the STS liked and average? I'm not saying anything wrong, they're just verifying the calculations. Can you please go over how to access or figure out which patient is from the source patient ID or record ID? Thank you. So the record ID is the number, I believe, is the number that your vendor software applies to the patient. So you would be able to look up that V number that IQVIA provides out in the detailed lines. You'll be able to look up that V number in your vendor software to identify the patient. Let me know if I answered your question, Cheryl. Next question. I thought if we needed to update a case, we would send in a single case file over. Why do you suggest? No, do not send in one file or one single case. It has to include a time frame. So it could even just be a day time frame. The reason why I was suggesting a week is just to make sure that nothing's off with it, so that you don't accidentally miss a day or enter in the wrong day and you think that you uploaded it. So I suggest using a week time just to make sure that you got it in there. Donna, if the smoking calculation is still not working right, I think that's one that Joe went over and said that is being updated. Is that right, Joe?
Yeah, so the smoking cessation update went through on the 28th. So if you haven't rerun your report since then, doing so might get you the updated results. So I think that's probably the best course of action, is just to rerun it and make sure that it looks better now than it did originally.
Great, thank you. Thanks, Joe. Have multiple critical errors on the anesthesia report, same questions on each patient. That is holding up all of my patient submission. Case closed at first level, no callback yet. Could you, I don't know if you have a ticket number, if you wanted to provide that to IQVIA, they could check into it and see what the critical error is that's holding you up.
Just to comment on that, so if your participant is enrolled in anesthesia, then you would need to provide the anesthesiologist MPI. So and the messages that you see, the critical messages, they will describe for you in the data quality report what is going on. So please do look at those and be aware that the anesthesiologist MPI would need to be provided if you're enrolled in anesthesia.
Yeah, and I see a comment further down that says, so do I need to go back and submit my MPIs for all my cases? Yes, your MPI is required for case submission. We were able to view the full star rating report like we used to be able to do. Right now, all we can do is print it out. So I'm not sure what you mean, Lori, by that. If you wanted to clarify that, I'll try to get to it, but we only have a few minutes left. The star report now is very similar to the PDF report that you all reviewed, and there is a drill down availability under the details star report. When looking at the harvest report and specifically blood uses for inter post-op percentages, am I reading it correctly that this is the percentage of patients who received blood products for both in-surgery and post-op? So there's an intra-op blood line, and then there's a post-op, and then I think there's going to be a combination one that's either out now, came out recently, or is going to be coming out, right, Jeanette?
Yes, I believe so. And I'm also seeing some comments, some questions related to pre-op beta blocker. So part of what's happened, and we have alluded to this on this call several times, but what was found in the risk-adjusted reports is that a number of participants were not addressing the errors that they were receiving in the system, and they were submitting time periods, whether that's time in the ICU, time on vent, that were inconsistent with dates that were either before, discharged before admission or something like that, on vent after off vent hours. So there was a number of updates that were made to remove those records that had inconsistencies from the calculations. So there was a change that was posted last week. It was listed in the notes about the updates. And there's more detailed information available in the notifications area in the system if you'd like to look. But a number of the calculations were adjusted to remove those data inconsistencies. And to Carol's point earlier, that is why the validations are changing severity, because it was found that the errors were not all being addressed. So to ensure that you don't encounter those sorts of data inconsistencies in future, those validations will be shifted to critical. But some of you may have noted that there was a change in some of the numbers that were presented last week. And that's because those inconsistent records were removed from the data set for analysis, just for those data points. We did not pull the entire record from analysis. They were only excluded from these sorts of calculations, just those data points or those rows in the benchmark sections.
Thank you. Thanks, Jeanette. So it is 3:00, and I unfortunately have to hop off for another call. But I will go through the remaining of the questions and see if there's something that we can answer. I can answer via email. And there's quite a few left, 45 actually, and we've already answered 60. So thank you all for joining. I'm sorry that we have to go and can't answer everybody's question live, but I will go through and see if there's something that I can answer, or if there's something specific to forward over to IQVIA, I will do that. So thanks again, everybody, for joining. Thank you, IQVIA, for your time today and for being helpful as always. I hope you all have a great day. Stay healthy and take care of each other. Thank you. Bye, everybody.